co-chairs of the Justice Committee of the Victorian Women Lawyers. I would like to begin this webinar by acknowledging the traditional owners of the land on which we are meeting today. From the land on which I'm speaking, I acknowledge the Wurundjeri people of the Kulin Nation and pay respects to elders past and present. Victorian Women Lawyers is a body that seeks to participate in matters of interest to the legal profession and promote the understanding of women's human rights, specifically in the law and legal system. The Justice Committee is responsible for using panels, projects and events to bring justice and human rights issues to the attention of Victorian women lawyers, justice-related groups and members of the legal profession. The Justice Committee wishes to thank Nicholes Family Law for their dedication to the topic of family violence and other legal issues affecting women in our community, and for their ongoing collaboration with Victorian Women Lawyers. I will now hand over to our moderator, Sally Nicholes, to introduce our panellists.
Thank you, Bronwyn, and thank you, Victorian Women's Lawyers, and thank you for everyone taking the time to be at this really important session. So welcome today to everyone to the panel discussion on family violence and the impact of COVID-19, support, prevention and reform post-pandemic. My name is Sally Nicholes. I'm Managing Partner of Nicholes Family Lawyers, and I have the honour of moderating today's discussion on one of the most pertinent and far-reaching issues that has come into greater focus as a result of this pandemic, family violence. The COVID-19 pandemic has dramatically altered the way we all live, work and interact. While the Victorian population has undergone a lengthy and strict lockdown, both the virus and the measures implemented to minimise its spread has taken a drastic toll on many of the most vulnerable in our society. Perhaps the most insidious and dangerous impact of the COVID-19 pandemic has been the significant increase in the incidence of family violence and gender-based violence propagated during this period. Indeed, law enforcement and family violence services have reported a surge in the prevalence and severity of family violence during this period, which brings the issue to the forefront of our discussion today. While the Victorian Government has stipulated that seeking help for family violence is a permitted reason to leave the home, it is evident that perpetrators have used the lockdown as a mechanism to further control and isolate their victims. Disclosure has repeatedly been a concern for family violence services, as a majority of women experience violence hesitate to engage with the police or affiliated agencies, especially while in a potentially coercive or controlling relationship with the offender. Therefore, the limited opportunity for women to disclose their experience to family violence services has compounded a pre-existing issue at the centre of this space. Increased situational stresses, which exacerbate incidences of family violence, such as financial stress and job insecurity. Survivors and perpetrators mandatorily isolating in the household together for extended periods of time. Practitioners have also reported an increase in first-time reports of intimate partner violence and the weaponising of children as part of shared care arrangements. In some unfortunate instances, perpetrators have used children and the threat of COVID-19 infection to gain access to women, to force them to share a house with their abuser when they previously lived separately, and to control access to children. In light of these factors, it is essential to closely monitor how the pandemic has exacerbated experiences of family violence, how the restrictions are affecting people's ability to seek help, and how we can support and how we can protect survivors. I do have the privilege of being joined today by vital stakeholders in family violence support and prevention in Victoria, who will share their insight into this area and the services their organisations provide to assist those who are the most susceptible in our community. I'd like to introduce our panel members today. We are delighted to have Tania Farha with us. Tania is the CEO of the Domestic Violence Resource Centre, Victoria and Domestic Violence Victoria. Tania previously worked with the UN in the Ending Violence Against Women section and held executive roles with the Crime Prevention and Countering Violent Extremism arm of the Department of Justice and Community Safety, the Multicultural Affairs, Social Cohesion and Equality arm of Victorian Department of Premier and Cabinet, and the Office of Prevention and Women's Equality within the Department of Premier and Cabinet. We also have Adele Murdolo. Adele is the Executive Director at the Multicultural Centre for Women's Health, a women's health centre run by and for migrant and refugee women. Adele is a second-generation Italian migrant woman with a background in feminist research and advocacy on the topics of violence against women, women's health, feminist history and activism. Adele has a PhD in History and Women's Studies and is an Honorary Senior Research Fellow at the Centre for Health Equity at the University of Melbourne. And we have Jessica Stott. Jessica is the Service Delivery Manager at the Women's Information and Referral Service, WIRE. WIRE is a Victoria-wide service providing support, information and referrals to women, non-binary and gender diverse people on any issue. She believes in the power and wisdom of lived experience and is committed to feminism as an everyday practice. She has an educational background in psychology and lives in a bustling household with her partner, their 4 children and a dog. And I can imagine that lived experience during lockdown is well and truly at the forefront, Jessica. So welcome to our panellists. I'll start with some general questions first, and I would invite any of our panellists to comment on this. Has the way family violence is being perpetrated changed during COVID-19 and why? Maybe Tania, could you perhaps start the ball rolling in that regard?
Well, thank you. Thanks, Sally, and thank you to Nicholes Family Law for having us here. I'll also just like to acknowledge the traditional lands on which we're meeting today and elders past, present and emerging. So in response to your first question, Sally, you very eloquently raised a lot of the issues I'm going to raise now, but what we've seen in the COVID-19 pandemic, based on feedback from our member services, the specialist family violence sector, we've seen an increase in the frequency and severity of family violence. Some hospitals have reported increased presentations of victim survivors at emergency departments, an increase in the complexity of victim survivors' needs and level of risk, and an increase in first-time reporting by victim survivors of family violence abuse, an increase in the prevalence of the psychological and emotional abuse. You've mentioned this, Sally, but weaponising the global health crisis and using the restrictions to further perpetrate family violence as a means of facilitating coercion and control. I think the stay-at-home directives and restrictions of social movement, of course, have also exacerbated some of the tactics that perpetrators have already been utilising. For example, greater monitoring and surveillance of and control of victim survivors due to extended periods of being at home together. Further isolation of victim survivors, so, telling victim survivors they can't leave the house, tightening controls over finance, an increase in financial abuse, increased risk for victim survivors with disabilities being cared for by the perpetrator due to limited or reduced provision of in-home care and limited interaction with external agencies and supports. And I think this has been a really important factor, the ability of lack of line of sight to what is actually really happening in the home. And that applies across both victim survivor and perpetrators. And I'm sure Adele will talk more to this too, but, exacerbation of migration-related abuse, threats of deportation. And I think we've also seen, and you also referred to these, Sally, so I won't talk too much more about them, but, new tactics which specifically relate to the pandemic, the idea of exposing children to the virus, using children, the shared parenting issues as well. So I think that's sort of, a brief, introduction into what we've seen happening.
And Jessica at WIRE, would you have anything in addition to Tania's comments to add?
Thank you, Sally. Thanks so much for the introduction as well. It's great to be here. I'm on the land of the Wurundjeri or Woiwurrung and Boonwurrung people today of the Kulin Nation. I'd like to pay my respects to their elders past, present and emerging, and also pay my respect to any Aboriginal people here today. My pronouns are she and her. Thanks so much, Tania, for that overview. It really fits with what we have experienced at WIRE. I think if you think about perpetration of violence as a way of using powers that people have to control other people, we've certainly seen perpetrators sort of taking advantage of the specific aspects of COVID-19, including the fear of infection and stigma around infection as a method of control, and particularly, as you say, control of access to children and movements of children. In addition to the sort of thinking about individual perpetrators, I think it's important to mention that the people who have been contacting us, who are generally the people identifying as victims of family violence, have shared a lot in terms of the systemic failure for them. So not so much, I'm not sort of trying to paint the system as a perpetrator necessarily, but just that the added layer of a changing service system and people's experiences of that, and the complexity of intersectionality. So the complexity of people's experiences, we've really seen this very clear correlation with the more kind of if someone's a sex worker or they're on a temporary visa, or they have a disability or age is a factor for them, the ways that those experiences have interrelated with people's experiences of the system has been a big theme that has kind of added on to the control that is used by perpetrators.
Adele, you have obviously a specific interest that Tania might have mentioned, or you might want to comment generally as well.
Thank you so much, Sally. And I'd like also to acknowledge that I'm meeting with you today on the lands of the Wurundjeri people. Sovereignty has not been ceded, and I'd like to pay my respects to elders past and present. Look, I think that Tania covered everything so well, and I don't have a lot to add. But I guess just perhaps to highlight one of the big challenges for migrant women pre-COVID and during COVID is gaining access to family violence services at an early point. Statistics show over the last 20 years, we don't have really great data, but the data we do have shows really clearly over that period that migrant women tend to access family violence services at a much later point in the violence than do other women. They also tend, even once they have sought support from services, perhaps not to follow as direct a trajectory into support, but it's a little more complex. And then once they have sought support, they do more often than other women go back to violent situation for various reasons as well. So the direct connection, I guess, between experiencing violence and accessing services is a little more complex and happens at a crisis point rather than an early intervention point. And I guess when we have a look at the data of women and other victim survivors accessing services during COVID, and we see that demand has gone up, it may not necessarily have gone up as much for migrant women. And I guess all of those barriers that were there before COVID are still there, and the barriers are actually even firmer than they were. Social isolation, women who don't necessarily have very good support networks because they might be have all family overseas, and they're really, when you settle in a new country, you're really building up all of those support networks, may not be as strong because of the isolation of COVID. You may not be going out to work. That can be a really good avenue for many women to access support. So, yes, I think that it's a situation where access to services probably for migrant women would have decreased rather than increased over this time.
I guess that leads into the question how the way family violence is being reported. Has that changed during COVID, would you think, Adele?
Look, and I guess that is part of the question, isn't it? That it's less likely, I think, amongst migrant women to be reported. But I don't know if that's, I wouldn't know whether there's been a big difference between now and before COVID. So maybe Tania would have more of a read on that question.
Like Adele said, I wouldn't have the data on the breakdown on the cohorts, but what we have seen, and be interesting to see what Jessica says to this too, though, Initially, Specialist Family Violence Services didn't see a spike in calls, in the very first lockdown. And I assume that was a huge concern, because that was probably indicating victim survivors were unable to get access to communications to seek support. In a few weeks into the lockdown, we did see a return to pre-COVID levels of requests for support, and now demand levels are similar to pre-COVID, although we're starting to see a report an increase in numbers now as well. And as I said to you, the types of report, the requests for supports have changed slightly, with more complex, higher risk victim survivors, a lot more anxiety. COVID as well, I think, exacerbating this too. A lot more calls from third parties and family and friends. So, that's a very interesting finding in COVID. And, we always talk about family violence is everybody's business. And I think there is a real learning for us out of here about how we really engage the community, and then more specifically family and friends, to provide that support when the service system is unable to get that line of support, line of sight. We have seen, you probably all have heard and seen the police data as well, because they have been doing some specifically proactive work. But the recent data from the Crime Statistics Agency found that the number of family violence incidents recorded in May and June was significantly higher than what would have been expected based on trends over the past 5 years. There was something like a 6.7 increase in the number of family violence incidents reported to Victoria Police from July 2019 to June 2020. And also the other thing that we found is web browsers. So Google, for example, Google searches, they've increased substantially. So people obviously looking for support or guidance or self-directed guidance. So I don't know, it'd be interesting to hear Jessica's,
Absolutely. Jessica, I know you'd have some examples for us.
Yeah, we've certainly noticed troughs and spikes, and in the past at Wire, we're always looking for patterns, of course, and I know that people in the past have always sort of said school holidays make a really big difference in how many people are contacting us, and that's certainly been the case during the pandemic. We noticed with the lockdowns and the homeschooling, it really, at first, there will be a drop in people contacting us about family violence, and then there'll be a big spike. Yeah, but I would say from a sort of a qualitative perspective, I suppose, just the complexity of people's situations has been markedly different. And I think that it's, we're all in this situation which is so unknown and unpredictable, and there's been so much change that people are really trying to sort of unpack what's going on for them, and really spending a lot of extra time and energy to sort of make sense of their situations. And the isolation, certainly in the second lockdown, that people's experiences of isolation and despair were really just coming through so strongly in people's stories. So the depth of what they were sharing with us, and then this real kind of, such a gratitude of being able to have space to speak about their situation and sort of sort through what's really going on for them, was really quite a remarkable difference in the way that people are reporting. And part of that sort of deep self-reflection was a lot of people identifying family violence for the first time, and not necessarily because it's happening for the first time, but perhaps more because it's heightened at this time, and their options for keeping themselves safe are so limited that things have kind of reached a really significant moment for people. And often the identification of the violence would come through the conversation about safety. So if you're approaching a property settlement now or thinking of leaving someone now, what do you think that is going to look like for your safety? And that is often the point that people can kind of link back to thinking about their relationships in terms of a family violence dynamic.
And how do you think their access to your type of services had changed, or was there any? How was it a little bit more dynamic, or did I have to put out different messaging to victim survivors during the pandemic?
Can you repeat that question, Sally? You're asking.
I was thinking because of the social restrictions, was there a different way that victim survivors could access resources? Did I have to be a little bit dynamic, or other NGOs, in trying to help victim survivors access your resources?
We certainly we had to make some changes to our service. So instead of people being able to call us and us picking up the phone, people have had to leave messages, which then we transcribe onto a sheet and return calls. So there was quite a marked difference in the amount of time that people would have to wait to receive a response from us. So we made that quite clear through our social media and newsletters to professionals as well, that there's likely to be a waiting time. And I think that, it's remarkable what people can do to sort of manage their situations and keep themselves safe for periods of time when they know that that's going to be necessary. So there have been those changes, but certainly the changes to the service system generally has been something that's come up time and time again for callers. It's been a lot to adjust to and a lot to make sense of for people.
I can imagine. I remember talking to the CEO of Panda, dealing with perinatal and parents who've got young children, babies, and their incidence of reporting went down. And they were concerned about that because they thought that often then the victim survivors were actually alone with the perpetrator and didn't have access to maternal health nurses, for example. And so I was thinking of Tania's comment that maybe third parties instead were actually navigating access to help. And that's perhaps why people were finding other ways of accessing help during this situation. And that's that repression and the fact that their numbers went down wasn't making them feel buoyed or comfortable at all. They really felt that the incident was in fact higher, but they were getting, their calls were coming through different avenues of people trying to access help and feeling very, very isolated too. So it's just, it's so important that third parties are reaching out. Tania, how has Victoria's systemic response to family violence adapted to manage perpetrator risk and victim survivor safety during the pandemic? Has this actually led to innovations in the way your organisations have worked?
So I think that, the first thing to say is the family violence services quickly pivoted to remote service delivery, actually. They're really commendable speed with which they moved everything online, including 24/7 phone lines. So that's with Safe Steps, which is a statewide crisis service, including web chat options, because of the idea of speaking is not always available, but the chance of perhaps being able to send a message over web chat, telehealth, psychiatry, keeping in touch with existing clients via video conferencing, and when necessary, still doing home visits and outreach, but still observing. Of course, this has been the struggle, during, managing the COVID safe practices and utilising PPE. So being able to manage the public health, infection safety restrictions, as well as be able to respond to people. I think the other thing we've seen is some specific guides and resources for the sector developed. So, for example, the specific MARAM practice guides and resources. So MARAM is the multi-agency risk assessment and management tools framework, and then there are tools. So this was adapted for COVID-19. There's been a lot of increased collaboration with allied services as well. So you can imagine alcohol and drugs, mental health, a whole range of those things where people could come in one door but need a service from somewhere else. Increased secondary consultations around family violence with these services. More increased collaboration with teams, multidisciplinary teams. And regarding perpetrator risk, there is work underway, and that this started pre-COVID, about information sharing around perpetrator risk relevant information, and that's put, I think, the system in a better position to consider perpetrator risk as well as victim survivor safety. And also the perpetrator services have really adapted as well to this. They've moved men's behaviour change programs online. There's been some recent announcements about supported accommodation options for perpetrators who are being excluded from the home to make sure that they can support victim survivors who stay at home. So there has been a range of things, I think, underway to try and manage what the system would normally have line of sight of that it doesn't during this period. Has it worked as best as it could? I think that, there needs to be a fair bit of evaluation and retrospective thinking about how this was done and what we've learned from it. And it'd be interesting to see if frontline services like Wire thought that would be something really useful.
Sure. Now, Adele, I remember when we meeting with Wire early days and asking what's one of the priorities, or what have you been experiencing, and hearing from Jessica and Julie Kuhn that one of the main issues was migrant women, and I would really love to hear your comment about what you believe is one of the main issues facing migrant women when it comes to addressing family violence. And how has COVID-19 impacted on migrant women in this regard? You've touched on it before, but it'd be lovely to hear you expand on those views.
Look, I think there are probably three main issues, and I have talked about the access issue already, so I'd add that in. Tania touched on visa category. This has become a huge issue. So I think when we were working in this space about 20 years ago, we would never, ever have spoken about what visa category women are on. Now it's a very complex system that is essentially a two-tier system where women who are on temporary visas have a very different experience to those who are on permanent visas. And this has become exacerbated through the pandemic. So I would say that the key issues are, as Tania's mentioned, that perpetrators can use visa category or threats of deportation as a part of the toolkit for violence. Women, of course, are more dependent on their perpetrators. So when it comes to acting on the violence that's occurring, the women have a much smaller range of options available to them. And within those range of options, there are complex legal issues involved. There is the real possibility of deportation, the very real possibility of being separated from children if women are on temporary visa and the perpetrator is on a permanent visa and the children were born in Australia. So there are some extremely complex issues involved there. And, it's a situation of enforced dependency on a perpetrator. We haven't, even though there have been some inroads into fixing this problem at a federal level, we haven't got anywhere near resolving the problem. So it's still a very live issue. One of the other things that happens is that women on temporary visas don't have access to housing programs. So they essentially get stuck in family violence services. So if they do manage to access a service and things are improving in their lives and they want to live independently and move into longer term housing, they don't have public housing options available to them. So they essentially get stuck. And so that puts family violence services in a really difficult position because they need to provide the service for women on temporary visas, but it also creates a logistical problem for the way that they are working with the women in family violence situations. So that's difficult. I think the other issue is economic security, and that, of course, kind of tumbles into every other issue. But essentially, amongst migrant women in Victoria and Australia more generally, we have a higher unemployment rate. We have a higher underemployment rate. and we have lower workforce participation. This is not necessarily because women don't want to work, migrant women don't want to work, but essentially because of gendered and race discrimination in the workforce that puts a lot of work out of their reach. They're also, those women who do work are concentrated in casual or contract employment, in poorly paid work that essentially often has limited opportunities for career advancement. So they also kind of get stuck in jobs that limit their capacity for independence and for autonomy of choice in their lives. And I guess one example of a woman who we contacted during COVID is actually, I'll just also talk a little bit about the way we changed our services during COVID, because essentially we're an education service. That's the work that we do with migrant women. And it's all face-to-face. So we'll go into their workplaces or into their schools or maternal and child health group sessions and provide in-language information about a whole range of issues, including family violence. So in March, when the restrictions started, we suddenly had to completely change the way that we reached women. We couldn't do face-to-face anymore, and we haven't done since March. So we had to find other mechanisms. So we started doing in-language radio, Zoom sessions, social media. But essentially, no matter what we did at that digital level, there are groups of women who we have no way of reaching. Another program that we ran was in public housing just after the Nine Towers lockdown, where we made calls to people in public housing, women in particular, but also trying to reach their families as well. And one of the cases that came up during that time was a woman who was living in public housing. She had managed to separate from the perpetrator that she had been living with. And so he had to find alternative housing. But the Office for Housing hadn't been able to find him any housing except for across the hallway of her unit.
Oh, dear.
So she felt extremely unsafe, and this was a big issue. We did, funnel that issue off to the Office for Housing to see whether they could actually address the problem. But I guess what I can see in that woman's situation is economic restraints, difficulties in gaining independence and remaining safe, which of course would have been there before COVID, but are extremely exacerbated after COVID. Also in the kind of housing that she was living in, an increased risk of catching COVID. So that also, of course, makes women vulnerable. If they're in a situation with a perpetrator and she's unwell, that's another level of difficulty that woman is dealing with. So I think that's essentially the key issues that we're finding have impacted on women. And just, I can't underscore strongly enough the impact of economic insecurity on migrant women.
Very, very poignant. And intersectionality is such a buzzword around the government at the moment. Does that dovetail in? Could you explain that and the impact for those listening?
Sure. Intersectionality is a way of understanding power, I suppose, and the ways that multiple forms of discrimination, so we're talking about gender discrimination, race discrimination on the basis of age or sexuality or class, can impact on an individual or a group. So I think intersectionality tends to focus on the social location and the group. And it is really important in the field of family violence for a few different reasons. One is because it helps us look beyond a one-dimensional view of gender, a gender analysis that only looks at gender as being the one form of discrimination that impacts on women, which helps us then better understand the differences between women in the ways that they experience family violence. So it's an important way of an important theory for migrant women in particular, because it really helps us see what's happening in their situations. I think the second thing that for me is really important is that it shifts your focus, because sometimes when we do an analysis of what causes family violence or women's experiences of family violence, we can sometimes focus a little bit too much on the individual. So, why doesn't the woman leave, and what is it that she can do to get out of her situation? How can we help her navigate systems? But when you're doing an intersectional approach, it really does shift your focus back up to the systems and structures. And therefore, it sees the solution as sitting squarely with those systems and structures, and helps you talk a little bit more about what the state and the government and those organisations need to do in order to change those systems, in order to, prevent family violence in the first place, so to get rid of the race and gender discrimination that's causing the problem, but also in terms of family violence systems, what needs to change at that level? How can we change the systems and structures for the benefit of victims, survivors of family violence?
Well, thank you, Adele. And Jessica, listening to both of our other speakers and also being at the coalface of what you're experiencing, what additional experiences is Wire really experiencing during this most recent and very strict lockdown? Is there anything else you want to add in terms of some of the specific experiences that are really poignant at the moment?
I think it's really important to note the different relationships in which family violence can occur. When we think about family violence as only something that happens between, say a married heterosexual couple, we're making a lot of other people's experiences invisible and more marginalised, and adding to their lack of safety. And even adding to sort of a victim-blaming narrative if we're not sort of believing that family violence is happening in different sort of, relationships. So, and we've had a lot of that, like people talking about how in their same-sex relationships the police were called but weren't able to identify a perpetrator because they were both women. So the police kind of got confused about that, and the victim was not believed in that situation by the police. We hear so much about elder abuse, which is often in the form of financial abuse. Mm-hmm. And sometimes the abuse, often financial again, that can happen in families that's perpetrated by one person but then impacts a number of people within the family. So if we're thinking about gender, and we're thinking about how men are often trusted more with money, an adult son could be using money to abuse elderly parents, but also to abuse siblings. And then when we look at those siblings, who are they? Are they sisters? Are they women? Or are they queer people? Or do they have mental health issues? Like, what are those sort of systems? What are the categories that we put each other in that gives some people more power over others? And when we're sort of looking at family violence as more of a power dynamic, it's not hard to see that it can happen in a range of different relationships rather than just among intimate partners.
I was talking to the CEO of Switchboard, who made the exact comment the other day, and did actually, one of their callers, they have a service now called Rainbow Door, commented that they had an attendance, a family violence attendance between two gay men, and no one checked to see whether there were children there, and there were children involved in the incident. So it's all those sorts of assumptions which are really difficult things. Everything's heightened, but there's no excuse for that sort of stereotyping. Very important comments, and in particular, as you say, Wire is identifies with non-binary, it's diverse, and it's so important to actually go beyond those stereotypes. What has been the experience of the wire service systems internally? We did touch on it a little bit earlier, but is there anything internally that you have modified or adapted that you wanted to comment on?
I think that probably, in addition to changing our service delivery, system a little bit, it's probably important to note that we've had at times where we've had a huge amount of demand, and at times it's been really overwhelming. So sometimes we'll start the day with, 10 times more people than we would be able to reach in a day. And we've had discussions about what to do, like should we contain calls more? Should we limit time? What are we going to do with this demand? But we keep coming back to the idea of that we're just not willing to compromise on the quality and the sort of depth of the service that we're providing to people. So I think the way that we've adapted is to be very true to the service delivery model that we have always used over 34 years and see how that can serve the community in this crisis environment. And the feedback that we've had from people using the service is that has been the part that they've been most grateful for, and that has been a point of difference, that we've been able to work through the complexity and the depth of their situations in a way that's not rushed, and really giving them the time that they need and to sort of do that thoroughly. So for us, it's resulted in spending probably more time on average with each person. But it's been really important to our integrity, but also the sustainability of our work, because I think that to have been put in a position to have to limit or contain or constrain the service that we've provided for people would have put us as workers at more risk of ethical burnout, if you like. So it's been this sort of being true to ourselves and remaining connected to our people in the community who contact us has been sort of the way that we've done that has meant that there's been a variation on the way that we've provided the service.
Oh, fabulous. And Tania, what challenges has the specialist family violence sector and the broader family violence response system faced during the pandemic?
Thanks for that. And it was just interesting, the issue around children too, because of course they're victim survivors in their own rights as well. And so just thinking about the challenges for the specialist family violence sector is also replicated in the broader system, of course, because this issue about line of sight has been really restricted across all services who traditionally work together, so specialist family violence services, child protection, children and family services more broadly. So I think we're seeing like a parallel issue across multiple services, which affects the systemic response. So some of the issues in particular about remote service delivery, making it more difficult to get in contact, with victim survivors to monitor risk and safety. And then at the same time, you don't have those other services also having line of sight of the families like they might have had previous to COVID. The increased monitoring and surveillance by the perpetrators and making it unsafe for victim survivors to get support in a way where they can be assured of privacy. There's been also immense pressure on family violence practitioners to provide support remotely in their own homes. They're also isolated, providing support to colleagues. They're separated from their colleagues and work structures, because you can imagine when you're doing something like a complex risk assessment, you rely a lot on peer engagement, in these processes, and that is not directly available to you. So, we've seen lots more people engaging with their supervisors, then that puts a lot of burden on that level and so forth. And I don't know, people might have seen the Monash research that came out yesterday or the day before regarding the impacts this has had on family violence practitioners and the system. And of course, like all, we're specialist family violence services and I assume some of those other allied services, very gendered services. So, women providing the responses, but also still doing a lot of the work in the home, homeschooling, a whole range of things that impact their ability, and also trying to do very, very difficult and complex work with children around them is no easy feat.
Yes. Yeah. Having to make that delivery knowing that it would be entirely inappropriate for children to overhear or be exposed themselves.
Yeah. Interesting one of the things I read in the Monash report was about someone having to go to the car to provide the service because they couldn't do it privately from the children. I mean, that has significant impact on the well-being of the workforce as well, in relation to that. And I think then the other thing we've seen, though, is the onus on the victim survivor to manage her safety, and I think Jessica might have referred to that too. Because of the, where the system might have normally have been there to do it, and if that access is not available, then you see some of that. And I think what we've seen about the broader family violence response system is that I think some of the gaps and the things that existed there have been so much more exacerbated. So the things that were probably problematic before but were being made up for by people's goodwill and, a whole range of things, when that is not possible, you really see the systemic and structural deficits really emerge, I think. And so really I think it's even more incumbent upon both the specialist system and the broader family violence system to work even more closely together in a time like this. And we've really tried to see that coming together. But when you don't have that line of sight, it's really difficult, I think.
Well, I was going to ask you, how have legal services contributed to perpetrator risk management and victim survivor safety during the pandemic?
Well, I guess the legal sector, and I guess what I'm particularly thinking of here is VLA, the Federation of Community Legal, and the Women's Legal Service. They were responsive and adapted their services during the pandemic to the online environment in the same way the other services were doing to ensure that people attending court or with legal issues could still access legal advice. But I guess there's been a whole range of issues with the courts move to online and then remote witness facilities, and that time it took for that to happen too, which would have impacted all of that. They've adapted to providing remote duty lawyer services online via phone, including remote hearings via WebEx for family violence intervention order applications. There's been a whole range of enhancements to the VLA legal help service, increased legal information and advice services via phone, increased web chat functionality to provide alternative means. I think access to accurate and timely legal information or advice for victim survivors' families is critically important to make sure they've got this information, they've got to make informed decisions during, before and during proceedings. And I think that, this is a really critical function the legal services have played during this period because, of course, we've seen also increase in justice procedures by police, so breaches of intervention orders and a whole range of support needed for victim survivors in that context.
Yes, because I remember early days it was so important to myth bust and for victim survivors to know that the courts were still available to victims of violence. It was really, really important for them to know because some perpetrators assumed that there was no law and order had gone. And we saw evidence of that early days, which is why we were so keen to get some podcasts and some information out very early with Wire and Law Week. So it was out there that domestic violence is not acceptable at any stage, and there was access to justice still during the early days of the pandemic.
Yeah, I think, we've seen some really good innovations come out of this, like from remote witness facilities, for example, and for a long time there's been a push to try and get, but I think the really important thing about this is to make sure it can be done safely, though, because if you have both, the respondent and the AFM doing, remote witness facilities, where are they doing it? Do they have the supports that you might normally get in the court with the services that are placed in, that there's been a whole lot of innovations. You would all know that better than me. But, so I think we just need to think about what is the good that we can keep, but how can we do it safely and well, and how is the service system supporting that moving forward?
And as you said before, I've actually taken instructions from so many women in their cars.
Yeah.
That actually resonates with me, whether they've been on FaceTime or they've been on Zoom, on their phones, in their cars, because it's the only way they've been able to get away, or on a walk with a mask and earphones, looking over their shoulder. And that aspect's been tragic, and they haven't been able to come to our office, and feel safe and supported. It's really, really difficult. Adele, how do you prevent family violence in migrant communities? I mean, it's a very broad question. Has primary prevention changed in the COVID context?
Yes. Look, it's great to shift to a focus on prevention, because it's a much more kind of long-term sustainable process that I guess gets us to a point where we don't have violence against women, which is where we all want to get. So, yes, look, we've talked about how gendered inequality is a key driver of violence against women, and, of course, the intersections with other forms of discrimination. And so thinking about that, primary prevention is a way of actually addressing some of those key drivers. So it's looking at wanting to get long-term and sustained change in relation to gendered attitudes, norms, practices, systems and structures. So that's generally speaking primary prevention. When you're doing it in migrant communities, it is very much the same approach, of course, but you do need to tailor your approach to make sure that you're taking into account the key issues affecting migrant communities. So you need to ask different questions. You've got to ask questions about, for example, how migration changes gendered expectations, gendered norms and expectations. You've got to ask questions about how stereotypes impact, because, when we look at perhaps gendered stereotypes, we might focus a little bit on, women expecting to be carers and women expecting to be thin, a whole lot of other things. But when you look at the gendered stereotypes of migrant women, you start to need to consider issues like how culture can be used as an explanation for violence, and how we need to completely unpack that idea in order to start preventing violence within multicultural communities and against migrant women. So, for example, that stereotype of migrant men as being more violent or more oppressive, and the stereotype of the corollary of that, which is the stereotype of migrant women as being more oppressed and, more willing to put up with that stuff because it's cultural. We've got to, when we do prevention within migrant communities, we've got to really question all of those stereotypes and myths. Talk to the media about how they represent violence against migrant women, where they do present cultural explanations when in fact, it's nothing to do with culture in that very narrow sense, or migrant communities. So it's a process of really challenging our gendered norms and attitudes, and looking at what kind of systems and structures like our visa system, make migrant women much more vulnerable to violence, and how we go about dismantling some of those, the way that we think about stuff, the practices we're using and the systems that we're following in order to start preventing violence against women.
And how can migrant men assist in this regard?
Yeah, that's a really good question, and something that we've thought a lot about at MCWH, because, we know men are the main perpetrators of violence against women, and in fact violence against anybody. But we also know that they need to also be part of the solution. And it's really important to understand how to do that in a way that is consistent with gender equality. So one of the things we were finding in migrant communities, when people from the outside of migrant communities would come in and they want to implement a gender equality project or a prevention project, is that they would tend to go to they've got the methodology of going to community leaders. And we've heard a lot about this during COVID, that they go to the community leaders to, make sure that people within that community have the information that they need. And that's a big problem, because what we think of as a community leader in a migrant context is often a migrant man. Women's leadership tends to be overlooked within migrant communities, when in fact, we've been working with migrant women leaders within their communities for many, many years. Back in 1975, the very first migrant women's refuge was set up by feminists in the Italian community. So there have been feminists within migrant communities from the beginning. There are very strong activist histories within all of the communities that migrant people come from. And so it's not a Western invention. It's not something that is new. So essentially, when we go into migrant communities to engage men, the first point that we often make is, okay, what's already happening in that community? Where are the women? What have they done so far? And how can we connect with that activism so far in order to engage the men in that community? Mm-hmm. So, there will be different strategies that will work for different communities. But essentially, you've got to do it by acknowledging the women's work so far and making sure that it's through them that men are engaged, not directly.
Stuff. And Jessica, what has been meaningful about the provision of wire services during COVID-19?
So much of it has been incredibly meaningful. I think that really having the privilege of hearing people's stories and having the tools to be able to facilitate a conversation with people that centres them and gives them a place to be heard and to explore their options and plan their next steps has just been so incredibly, interesting and a real privilege. And to be, I think that people have been particularly resourceful and gracious and courageous during this time, and knowing people know that there is no easy solution at a time like this. So there's been this incredible sort of willingness to advocate for themselves and to explore resources that don't rely on the service system, to sort of dig into their inner resources, and just to be witness to that has been incredibly meaningful and moving. Also, Tania, talking about what family violence workers working in isolation, the way that we have done it with WIRE is we've worked in a remote team. So we work on an 8-hour Zoom meeting in teams every day, so that sort of collaborative practice, and we use a breakout room for debriefing. And so it's been a really bonding time for the service delivery team at WIRE, and a time that we've been able to really do a lot of self-reflective practice and refine our practice, and that's been really meaningful as well. And just to what you were saying, Adele, about challenging people's discriminatory attitudes, we've been working on our ability to do that with our callers, and it leads to some really interesting and deep discussions. So, for example, if a caller is talking about violence that's happening to them and says it's because the perpetrator's from a particular cultural background, we can challenge that. When we have a connection and a rapport with the caller, we can open that up, so that we're doing that sort of prevention work with people who are experiencing violence, because prevention work must be whole of population work. It's not, there's no us and them in it. It's whole of population, community attitudinal change that needs to happen. So being able to sort of work out how to be nuanced enough to challenge people's own discriminatory perceptions of their own experiences has been really meaningful, and often leads to, because the cultural or other sort of ways that we stereotype perpetrators can be a way of excusing perpetrators.
Yes.
And not looking clearly at the violent behaviours are the responsibility of that person. It doesn't matter what their mental health status is, or how much alcohol they use, or their cultural background. And so by sort of busting that myth for people, they're able to excuse their perpetrators less and see their own picture more clearly. So that's been really meaningful as well.
And have you seen any community shift towards family violence during this time? Have you seen anything as you've been working with the community?
A shift in community attitudes? I have observed a polarisation in community attitudes. I think for some people, the systemic injustice and the way that racism is used and sexism are used to block people out of access to services and opportunities and safety and financial security. I think for some people that's become really clear. I think that the lockdown of the public housing towers was a really significant moment for that, and it sort of enabled some people to see that there is no reason for that really that is excusable, and that because the function of it became so visible that it functioned to perpetuate racism, and to serve as a threat to other people in the community as well, that if, this is the environment that we're living in COVID, that things can be heavily policed at any time. So I think that sort of systemic oppression became really clear to a lot of people. But on the other hand, I think there's been a reversion back to victim blaming, which has become more, and I suppose it's through fear, but I'm thinking of examples like we've spoken to people who have been discouraged from seeking intervention orders because different professionals have advised them that it's likely to escalate the violence, but the people who have been speaking to have been sex workers. So there's been this kind of, underlying sort of a narrative that their safety is not as important or is somehow can be compromised because of their sex work. So I think that, I would say that there's been a sort of a polarisation of community attitudes during this time.
Yeah, I would agree. I'll put this out to all of our panellists. What kind of strategies or public policy would make a difference right now for the better?
I could start with that one. I think thinking about the economic policies that would impact women more generally, and most disadvantaged women more particularly, in terms of COVID recovery, we really need public policy that includes and puts at the forefront those industries and occupations where women work, and they need to, be really focused on as a part of the economic recovery plan. And then women, of course, need to be supported to participate in those recovery programs. So things that have been talked about are childcare, for example. Why not boost the childcare industry, which comes back fourfold in terms of return on investment. I think the tradies have got enough from the federal government, from the budget that we've seen. Why don't we focus on some of those the caring industries, social assistance, where women predominate, and make sure that also, I think one of the other things we've seen is the impact of poorly paid contract labour. And we really need to make some changes there. Because we're just not, it's having an impact on safety, it's having an impact on good health and well-being. We really need to boost the stability of those types of jobs.
I might say something. I agree 100% with Adele, but I think one of the things that really, and I think this is where Jessica was going to, one of the things that really became obvious during this pandemic was inequalities and intersecting inequalities and, you know, the economic insecurity, particularly of certain workforces which are gendered, you know, is really obvious. And I think that in addition to economic recovery and the structural systemic changes we want to make there, we need also a good focus on social recovery as well, like to address these things like polarisation, these issues about are the service systems going to be there that help people to participate and be part of an economic recovery. You know, so I think there needs to be a focus there. So really strong and well-resourced services that can support people back into a community, a more cohesive one, because of some of this polarisation, I think is going to be really critical.
And what do you think needs to be prioritised during COVID recovery in terms of responding to family violence, managing perpetrator risk and ensuring survivor safety? Jessica, would you like to comment on that?
I would add that I think primary prevention needs to be a continued focus, because while we're just focusing on the response, we're just catching people really, and we're not doing much to change the system. So, yeah, a real, you know, continued focus on primary prevention as core to the future rather than as a luxurious add-on in terms of funding and priority. And the sort of a focus on the structures that our culture is built on in terms of colonisation, and really paying attention to that and understanding it as the starting place for the inequality that we're living in and the violence that we live with now, so that we can, you know, really think about what it would be to have a different system.
I'm really grateful to our panellists. I know there will probably be questions for you, and we're very happy to filter any for those attending through our firm. Look, in conclusion, I want to thank all of our panellists for joining us today and sharing their invaluable insights into this critical area. And I want to comment that I think, you know, as we've gleaned today, culture is no excuse for family violence. I kept getting stumped because I wanted to keep exploring so many different areas with these panellists, and I just knew that we had to move on to different areas. I could have actually chatted and engaged with you all day, and I'd like to continue if our panellists have a few minutes to chat and thank you personally. But while the future developments of the COVID-19 pandemic remain unknown, this discussion has provided more certainty, I believe, into the key areas that we must continue to address in the effort to support and prevent incidences of family violence in our community. It's been such a privilege to moderate this discussion and support the community effort to protect those who are most vulnerable in our community due to COVID-19. And I do agree with you, Jessica, and I know Adele grabbed onto it as well. And its prevention should not be a luxury. It should be one of our key areas to concentrate on. If listening to this webinar has raised personal issues for you regarding family or other types of violence and you require assistance, help is available. If you are at immediate risk of family violence, please call the police or 000. Other support, of course, can be found by contacting organisations including WIRE, the Multicultural Centre for Women's Health, the Domestic Violence Resource Centre, Victoria, and Domestic Violence Victoria. 1-800-RESPECT, Safe Steps, Switchboard, and White Ribbon Australia. Thank you all for attending today, and we look forward to gathering again with Victorian Women's Lawyers at WIRE and our other key stakeholders today for another seminar or webinar, hopefully in person in the not too distant future. So thank you very much.